Hi Samantha, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right now we're just going to go through the anatomy and have a good look at everything. We examined your shoulder before we even started, and there was no stiffness, and that was encouraging. So we aren't expecting to find any kind of frozen shoulder, and at least on first glance we're confirming that there's really no significant inflammation here. Here's the biceps tendon running up between 6 and 12 o'clock on the right side of that clear cannula. We can look as it exits the shoulder, and that looks normal. We can look down at the biceps anchor, and this also looks stable. No signs of any detachment. I'm going to rotate around and look towards the back of the shoulder. And this is the posterior labrum and the posterior glenoid. You can see a little bit of a roughness on the far inferior portion of the glenoid, but that's microscopic in nature. Even so, we can still smooth that out in just a minute. This is the posterior capsule, which looks normal. Here's the insertion into the humeral head, looks normal. We'll come back up and look at the rotator cuff. To do that, we usually put the cannula on the other side of the biceps, and now we get a good look at the top of the screen, which is where the rotator cuff is inserting. I'm going to put the shaver in just to get a little bit of that synovial tissue out of our field of view here. Read a little bit of the labrum. Now we can look up at the cuff again, and that looks pretty good. Let's look down the front of the shoulder. This is the anterior labrum here. This looks good. Here's the anterior ligaments, which look good. Anterior band of the inferior glenohumeral ligament. Here's that little area in the labrum that's in the glenoid that's so small. Our shaver just about the limits of what we can debride. Okay. And so I think we're done inside the joint. The articular surfaces look good. I really don't see any signs of any significant pathology here. We're going to have one more look around, but I think this will be the end of the video of the inside of the joint. Next, we're going to look up in the subacromial space. Pause, please. Okay, we're just finishing up here in the subacromial space. We've investigated. We did not find any significant scar tissue. We're taking off a little bit of the anterior lip of the acromion. You can see this is the amount of bone we're taking off here. It's about 4 millimeters. Just to make sure and protect you from having any rotator cuff problems in the future. Hopefully, we're just going to make this acromion nice and flat for you, especially given that some of your symptoms could have related to having some impingement. So now that's nice and flat at the top of the screen. Okay, happy with that. So hold the camera, please. So now we're going to go ahead and take our shaver and have a look at this rotator cuff and make sure that there's nothing else to worry about from this side. Here's our shaver. And so we'll look down in the front first. And what we're shaving is just synovial tissue. That's normal. So we're going to abduct the shoulder and externally rotate. So this is the anterior portion. And then as we slowly follow me back here, there's the rotator cuff rotating. See how it rotates when I move your shoulder? And there's no signs of any tearing here. Back to the back here. And now we've seen all the way to the back, so we really don't see anything else that's a problem with the rotating around at 3 o'clock. And so that's really good news. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye. Pause, please.